Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video, time for another revealing tale, and please share this with someone you care about. So I want to tell you about Ben and Sharon, who have been really careful throughout this entire pandemic, and they are the only caretakers for an elderly parent. They both hold down jobs that require them to be in person, and they've been super careful to follow public health precautions, both at work, at home, and when out and about. Avoiding being in close contact with anyone outside their home, avoiding crowds, keeping their distance, limiting time around others, wearing a mask when they can't, and good hand hygiene. And so far, they've been really healthy. But last week, Ben got a headache and sinus congestion. Not unusual for him this time of the year, as he has a history of spring allergies. But the next day, he felt really well. 2 days later, on a routine screening test, though, he tested positive for COVID. Now, neither Ben or Sharon had been vaccinated, and there is no way for Ben to fully isolate at home. The elderly parent was 2 weeks past their second dose, so had full benefit from vaccination. And on day 5 after the test, Ben starts to have symptoms of COVID. So what does all this mean? Well, Ben is in isolation for at least 10 days, as long as he then meets the criteria for no longer being considered contagious. At least 10 days from the onset of symptoms, or test if there aren't no symptoms, no fever for 24 hours, off any fever-reducing medicine, and symptoms that are improving. Hopefully, he does not get really ill. And hopefully, he does not develop what's called long COVID, prolonged symptoms that go on for weeks or months, seen most often in those with milder illness. Sharon starts her 14-day quarantine. On the last day, she is in close contact with Ben. Within 6 feet for more than 15 minutes without wearing a face covering. That's the definition of being in close contact. But since he cannot fully isolate from her, that means she starts after his 10 days, as long as he meets the criteria for clearance. That means at least 24-day quarantine for Sharon. And here's the kicker. Had she been fully vaccinated, she would not have had to quarantine at all. And what if she gets symptoms or tests positive? Now she carries all the risks that Ben does. For Ben, had he been able to be vaccinated, he may well have not gotten sick at all. And if so, his risk of serious illness and death would have been markedly reduced. And what about the elderly parent? Who will care for them now? So, what should we take away from this tale? Well, COVID is here. It's not gone away. And getting vaccinated has clear benefits for you and for those close to you and those you care about. Getting vaccinated has clear benefits for your health. Getting vaccinated has clear benefits for your ability to continue working. Getting vaccinated has clear benefits for those you care about. So be well and be careful, especially right now.